I'm Jerry Hesch from the Hesch Institute in Aurora, Colorado. I'm a physical therapist and orthopedic manual physical therapist, which means that I treat joints. And Tom is 62 years old and presents with an extremely rigid pelvis. His hips are very rigid going into internal rotation. There's only about 10 degrees of internal rotation, and then the joint becomes very stiff. Pelvic mobility is restricted throughout. So he's lying on his back, and when I try and glide his pelvis to the left, it's extremely rigid. When I try and rotate the pelvis backwards on the right side, it's extremely rigid, and the same thing on the left side. Let's have you lie on your stomach. There's no superior mobility through the sacroiliac joints. There's no inferior mobility on either side. And I'm trying to induce forward rotation of the ilium. Nope, no movement there. I'm trying to spring the sacrum. There's no movement there. And the sacrotuberous ligament feels very, very tight. Now the sacrum is prominent. So I'm on a bump called the PSIS, the posterior superior iliac spine, and the sacrum is higher, more posterior than those bumps. That's an unusual finding, and we name that posterior glide fixation of the sacrum. And if this is treatable, then we will treat it by restoring posteromedial glide of each ilium and restoring anterior glide to the sacrum. And that's performed very gently, and it takes 5 minutes of resting on foam under each side of the pelvis. Now we do that for 5 minutes, and then we come back and then we lean on the sacrum for another 5 minutes. I'm going to stop filming now. I'm not going to point out the fact that his upper cervical spine is very, very rigid in response to this pattern. That's a common finding, but we'll just focus on his pelvis for now. So I'll stop filming now, and after treatment we'll come film the response to treatment.